I'm Kirsten Ostherr. I'm the director of the Medical Humanities Research Institute at Rice University. The Medical Humanities Research Institute is one of the only research institutes in the world that is focused on doing translational medical humanities research that brings the insights of the humanities into healthcare research and practice. The Medical Humanities Research Institute at Rice is one of the only research institutes in the world that is solely focused on doing medical humanities research that really elevates the focus on addressing questions that can't be answered through biomedical research methods alone. So we look at a lot of issues that take place in healthcare that have to do with the human experience of health and illness and the ways that people's narratives play a role in shaping how we understand what's going on with them and how to take care of them. And a lot of what's involved in that you can't get at through the standard statistical and quantitative methods that are typically deployed in biomedical research, and that's where humanities methods come in. We are one of the only institutes in this country that's doing that, and indeed in the world, and because of that, we have quickly become internationally prominent, and we have a lot of collaborators around the United States and around the world who are interested in our approach to translational medical humanities. And so we have rapidly gained a lot of attention and a lot of collaborators who are interested in working with us. In my view, there are very few health or medical research questions that don't have a human component to them at some point. So a lot of our colleagues in the sciences are doing research on diseases, and they look at those diseases maybe at the cellular level, but those cells are from people. And ultimately, if they discover a cure for an illness, that illness occurs in people. And those people come from all different backgrounds and have many different experiences culturally, religiously, linguistically, that shape the way that they interact with the healthcare system. So there's a place for medical humanities in pretty much any kind of research that is happening at Rice. And some of them were really directly involved in. For example, we have a lot of research that's going on right now related to AI, which is obviously a computational area of research, but it's also a medical humanities area of research. There are very few health AI initiatives out there that have a real role for the humanities in them. And by not having the humanities in them, many of these efforts are really focused on either the technology alone or the business opportunity that is perceived in health AI. But what we're trying to do is actually ask, what would it take to make health AI actually beneficial for large numbers of patients and especially underserved patients? So this is a unique vantage point that really is not widely represented but is widely needed. By working with these communities and hearing their experiences and their narratives, we'll translate that into guidelines for trustworthy AI development that we bring to technology developers. So we see the humanities as playing a role really right at the foundation of how we can rethink how we develop AI tools so that they are addressing questions that matter most to communities whose voices have not typically been heard in technology development settings for healthcare or otherwise. And by being at the start of the process, we will integrate the values and the priorities of patients and humanities methods for surfacing those priorities throughout the entire technology development ecosystem. There's very little, if any, AI out there that has been developed for healthcare use that has brought patient perspectives or concerns into consideration in either defining what problems they're trying to solve or bringing in advisors on how they should go about tackling these problems. And I see our involvement in this whole ecosystem as having a potentially transformative effect by really showing what difference it can make when you bring those voices in. And in particular, how doing so can lead to the development of trustworthy tools that are worth the investment of resources that is presently being poured into AI. We have gotten the attention of a lot of researchers around the world who are interested in learning from us and learning how to do what we're doing where they are. So one of the things I'm excited about is that we've been contacted by a delegation from South Korea that is coming to visit us in order to learn more about the kinds of activities that we're undertaking, the research that we're doing, the methods that we're pioneering. And we're excited about this because we see this as not only an opportunity for international research collaboration, but also as an opportunity for our undergraduate students, graduate students, postdocs, and our faculty to engage in knowledge exchange and to further expand the scope of the work that we're doing. So that's one activity that we have coming up that I'm really excited about. We also have a delegation from France coming. That's a follow-up to an event that we held at the Rice Global Paris campus. And we're really excited about all of our international collaborations because medical humanities is a growing field worldwide, and many people have found our approach, and especially our translational approach, to be really compelling, and it's exciting for us to interact with researchers around the world to spread the impact of the work that we're doing here.